Hey everybody, good seeing you again. This is part 2 of Beat the Virus. The first video was about a month ago, and as you can tell, I've had to learn how to cut my own hair. I think I'm probably going to stick with being a PT for now, for obvious reasons. But anyway, remember the purpose of these videos is to disrupt the prolonged sitting that we see, especially with older adults, to reduce functional decline. They're not meant to reverse or really reduce disease progression or reduce falls, okay? For that, you need much more challenging exercises. So if you have an S3, use that. Or if you have somebody who can help you do some more aggressive standing balance exercises like we have on s3balance.com, please, those should be done every day. And remember, this program should be done at least every day, multiple times a day. And if you go to s3balance.com, there is a handout for this. It's a guide sheet, and you can use that as you do this, okay? So without further ado, let's get started. And we're back with my mom. Good seeing you again, Mom. So the first movement is going to be, we're using the counter, and it's called face the counter, lean forward. Go ahead, Mom. So you're going to get forward, and she's about 4 inches away from the counter, as you can see, and to tell, she's making a fist. And that gives her kind of a good guideline to see how far away she is from the counter. So we don't want you too far away from the counter because you're going to see here why that's the case. So Mom, now go ahead and you're going to position yourself. So she has her hands barely touching the counter. Now she's going to gently kind of lift her hands up a little bit, and now she's going to lean forward toward the counter. What you're thinking of is trying to keep your body as straight as possible, like you have a 2x4 from your neck down to your knees, okay? And you're trying to keep the body straight. Notice her heels are coming up, okay? And she's leaning forward. She's going to hold that for about 30 seconds, and then she's going to come back. And she comes back. Good. So what this does is it stimulates or trains, wakes up, for lack of a better term, the calves, the hamstrings, the glutes, the low back, even the entire upper back, and basically the whole entire back and the neck. So a lot of stuff happening there. Next is we actually flip that. So now we're going to turn her around carefully, and slowly. She forgets she's higher functioning. Okay, but make sure this turn is slow and that the hands are always on the counter and the feet are forward. So the feet need to stay forward this way. There you go. So then that way, any loss of balance, and she's just going to use the counter for stability, okay? You don't want the feet back towards the counter because then you can lose balance and go forward. We always want her going that way toward the counter. Now, it's the same thing. So now with her hands, she's gently going to lift her hands up and she's going to lean toward the counter, okay? She's going to try to lean toward the counter, and notice her toes are coming up, which is just fine. So now we're getting the entire other side. So the front of the shin there, the shin muscles, which are tibialis anterior, the quads, the hip flexors, and even the abdominals, okay? But what we're doing is we're just getting the other side of what we just did. And you can tell she's working at it. Now, people that are lower functioning, remember, they don't have to be as far away from the counter, and they may just barely lean, and that's it. They're not going to get much of a lean at all. Good job, Mom. And then the next one we're going to do, she's going to turn around, but her hands are, remember, the hands are going to stay on the counter. I want to reiterate that. Remember, this is for lower functioning folks. Let them hold on to the counter the whole time. It's perfectly fine. Go ahead and turn around carefully and slowly. Ooh, I like that. That's much better. And now we're going to do palms up, leg out. You know, the hip muscles get really weak with prolonged sitting. Okay, and we know that weak hip muscles can lead to more falls. So this is a good way to kind of wake it up. And so her palms are up, notice that. I'm going to explain why in a second. And now let's go ahead and do your left side. She's going to lift up and lift out to the side that left leg, and then back out again. And she's trying to keep the knee as straight as she can. Most people, they're going to bend that knee quite a bit. And the reason they do that is because of a really weak hip. You want to try to keep that knee as straight as possible, okay? Now let me explain on the palms up deal. If she turns her hands over, it makes it much easier because now she can use her lats more to stabilize her pelvis. You want to try to keep the pelvis as still as possible. It makes those muscles work harder and challenge balance. Good job, Mom. The next one we actually did as part of the first installment, but it is so important, we're gonna do it again. And it's the shoulder stretch. So Mom, go ahead and face forward. And then remember, the palms need to be up. Okay, the palms are up. And then now, she just simply walks the feet back, slides the hands forward if she likes, and there she goes. And notice she's trying to keep her back straight and flat, and her head, she's not really dropping it. She's keeping it nice and straight. You're probably gonna feel this, the stretch in the hamstrings and the low back as well, tends to feel pretty good. And you hold that for 30 to 60 seconds. But this feels really good, especially after you've been sitting for a long time. That's good, Mom. The next one is a 3-spot reach, okay? A little weird, but effective, okay? Mom, go ahead and face forward. And now we're gonna use her left arm first, okay? And you do it with both arms. She's gonna stand the same as she did with the first one, about 4 inches away from the counter, or her fists away from the counter. And what she's gonna do is she's gonna reach with her left arm as far out to the side as she can on the counter, okay? And then reach to the middle. That's the second spot. And then out to the third spot. And then now stand back up. And then she repeats that. Go ahead, Mom. And then out to this side, and then the middle, and then to that side. Now, as you can tell, what this does, it really recruits not just the low back, but your glutes and the hamstrings and the quads, okay? If your low back, what should you do? Bend your knees just a little bit, okay? Bend your knees. Now go ahead and do the same thing. And then if you still feel it in your low back, I don't want you to reach as far. Go ahead and just reduce the amount of reach that you have, okay? Good job, Mom. And then the palms up, leg back. This is like the leg out to the side, except we're going back. This is really for the glute max, big muscle back here, your bootissimo, so to speak. So palms up, and then now let's do the left leg so they can see. You're gonna bring that leg back, but notice, not very far. You only have about 10 degrees of hip extension available because of certain ligaments in the hip itself. So you shouldn't be able to lift it back very far. If you can, guess what you're doing? You're arching your back. So you want to keep this really still, and go ahead and extend, Mom. Good, and then back out again. Good, and she's trying to keep that straight, but please, no arching of the back. It's harder than you think, and it really makes those muscles work. Good job, Mom. And then the last thing is a shoulder squeeze. Okay, Mom, so you're gonna lean forward, and she's actually gonna, wrong one. She's gonna lean against the counter. Hey, normal. She's gonna lean against the counter, and then now, notice she is leaning her weight against the counter. She's gonna bring her arms up to about here, kind of mid-range, and then she's gonna pull back and squeeze. And make sure that you breathe, people. This goes for all of them. Please make sure that you breathe normal, and you squeeze back. Try not to shrug. There's a strong tendency to shrug here. Keep that down. Yeah, so we don't do that. And pull back as far as you can. You're trying to squeeze basically like a pencil between your shoulder blades, okay? But notice she is leaning against the counter, so it's really impossible to lose your balance. And if it's too easy, what can you do? You can bring your arms up and now bring it straight back again. That's gonna make it harder. It's also gonna work the shoulder and the neck more. If that's too hard, you just bring your elbows down and then you come straight back. But again, the hard part here is to not shrug. Everyone likes to shrug. You gotta keep this down and pull back, okay? Good job, Mom. So again, several times a day on a scale of 0 to 10 intensity, maybe like a 3 or a 4. Don't push this. It's really not necessary, and frankly, it's not what this program is supposed to do, okay? A couple other things, make sure you drink water. That's a big thing with older adults. Breathe normally, take time, make sure you breathe, no holding your breath. And remember also, it's physical distancing, not social distancing. Pick up the phone, call loved ones, do FaceTime, whatever it takes, but please, don't go a day without talking to loved ones and friends. Good luck and stay safe.